Hello, this is Dr. Lewerenz from Longevity Health Institute and Lewerenz Medical Center. Hope this finds you well. Bringing you an antiviral immune boosting update, obviously, on the recent COVID-19. So this is an update. I've kind of told you before about these things will be all evolving and fluid, and I'm going to try to bring you the best in a functional medicine holistic approach. Obviously being mostly evidence-based with some strong clinical and scientific peer-reviewed data, and I want to cover some things with you. Now, some of this stuff we've actually already talked about, and I've mentioned in other videos, and I'll reiterate a little bit, okay? But there's some new evidence that, listen, if we can use some natural occurring anti-inflammatory, plant-based supplements, herbs, etc., amino acids, these things have good peer-reviewed studies that show that they inhibit something that it is called NLRP3 inflammasome. And basically, if you can inhibit this NLRP3 inflammasome, you can slow down, okay, the inflammatory cytokine reaction from the COVID-19 virus. So you slow down the viral replication. And you're going to hear this on the news and in scientific data and journals, and you're going to hear this probably over and over and over in the next several months as data and studies come out, and even hopefully when we get better antiviral therapies and medications, okay, because basically if you can slow down this viral replication that seems to be pretty aggressive, you're slowing down something called nuclear factor kappa beta, which is another inflammatory reaction. And anytime you get this over-immune reaction of these inflammatory cytokines, you're going to destroy lung tissue. So you go then from having a fever, respiratory issues, coughing, into more progressive respiratory stuff, which would be literally respiratory distress, and then eventually end up on ECMO or what's called a ventilator, and you're aware of this. So the whole idea here is to use natural supplements, natural resources that are pretty common, some are very common, and I'll cover these. And then I want to focus on a couple that have the most peer-reviewed studies on and the strongest evidence and the most clinical evidence. And I will tell you, you're hearing this already on the news, okay? But the whole idea is to slow down viral replication and slow down NLRP3 inflammasome. So if you look that up, basically you're slowing down inflammation, basically the nuts and bolts of this. Mostly there is some evidence that the new antiviral drugs are going to be working on this protease virus, enzyme activity to slow down replication. And that's the whole idea of these natural supplements. So you've heard me mention things like curcumin, which is an herb that's wonderful. You've heard me mention things like vitamin A, vitamin D, vitamin C. These are very antiviral and immune boosting. You've heard me mention about green tea. I personally love green tea, but 4 cups a day gets you enough EGCG, which is an amino acid. It's roughly around 225 milligrams. So drink your green tea, okay? It's, I think, best to just drink the tea 4 cups a day, then take a supplement of EGCG. But you can take the supplement of EGCG. That is very antiviral and immune boosting. Resveratrol, another herb. Quercetin, you've heard me talk about this, is opening up and causing an ionoform effect from the zinc to get in to the COVID-19 virus. So quercetin's very key. And then N-acetylcysteine, you've heard me talk about it. I'm going to go back and cover that because that's the one I want to focus on today. N-acetylcysteine is really underappreciated, I think, in this COVID-19 natural supportive therapies that can give you the most benefit. I'm a big believer in DHEA as an immune hormone for adrenal support, and actually melatonin to help induce sleep, and also has some studies on it as a influence on your immune system for a viral immune support, particularly influenza, but we're going to assume that it's got some ability with coronaviruses. So let me just cover a big one. Now, peer-reviewed, the biggest studies and the most strongest evidence on peer-reviewed studies is the vitamin D, the vitamin C. Vitamin C, by the way, about 3,000 milligrams. But if you actually get significantly sick, we try to raise that up to diarrhea, even effects, even though it causes some intestinal distress like that. But so you get about 10,000. And you can split dose it. You can get buffered C. I'll cover this again at the end of the video where you can get this stuff on our website and the amounts. But those have strong evidence. Probably the strongest evidence out is C, D, quercetin, and this NAC, okay? So, but they're all important. They're all important. In fact, we believe this cocktail that you can take that boosts immunity and has antiviral ability is giving your best chance to fight many viruses, but include this COVID-19. So let me go over NAC a bit. So NAC stands for N-acetylcysteine. Actually, in the medical hospital setting, it's called mucomist, and it's used for some overdoses and some other effects in the body. But what's interesting is it actually has some peer-reviewed studies on influenza and a Chinese study on shortening the course of coronavirus. And it's down to 4 days less when people are have any respiratory difficulty or respiratory distress, coughing, dyspnea, etc. So usually in about the 600 milligram 2 times a day, NAC has a great ability to cause this immune ability, but anti-mucolytic ability, and it raises something called glutathione. Glutathione is actually a big antioxidant in the body, and it helps all cellular repair. So let's go backwards and talk about this NLRP3 inflammasome, which damages the alveoli of the lung. So picture you have a lung, and the lining in the lung, these little tiny alveoli are like little tiny gas air bubbles, essentially, that you get oxygen exchange, okay? And those are the things that start to get damaged and leak fluid and literally eventually get fibrotic. And this is what the NLRP3 inflammasome is actually damaging from the COVID-19, okay? So anything you can do that is going to help support the lung in an anti-inflammatory ability, and glutathione actually has ability to do some cellular repair. So NAC, we believe, not only is antiviral, okay, per se, it's antiviral, but it's also having this anti-mucolytic effect for your cough, but it's also having this repair mechanism in the body from the glutathione, so raising your glutathione pools. So I like 600 milligrams twice a day for the week, roughly around when you're sick. And when you get into, and I've talked about in previous videos, when you get into effects of your lung and respiratory distress and short of breath, this is the important thing to actually have on board. So again, important: A, D, C, curcumin, e.g. CG from green tea, resveratrol, quercetin and zinc. Quercetin and zinc, huge. Quercetin opens up the virus, lets zinc get in. Zinc is very antiviral. But I'd like to use NAC when you have a symptom because of the glutathione effect and the glutathione pools, and actually anti-inflammatory and mucolytic effect on the lung. So now I will mention something, and I'm going to do another video on this later. It's very important for you guys out there. Share this and tell others. You need to get your hands on a nebulizer. Everybody should have a nebulizer in their house, if possible, for a family. But if you have a nebulizer, you're going to have the ability to nebulize silver. And silver and a few other things that I've covered in other videos are very, very important to actually open your lung and have an antiviral effect, and to win this essentially cytokine storm and viral storm. But you got to get your hands on a nebulizer. Now we have, and we do consults here. We take new patients all the time. We do telemedicine every day, keeping the well, and building your immune system. I think what we're going to learn from this is this: that yes, when you're older and you have morbid diseases, diabetes, heart disease, hypertension, obesity, you smoke, okay, over the age of 55, 60, your risks of having more significant respiratory distress, okay, from this SARS-2, this COVID-19, is going to show it's a much higher mortality rate. Okay, I think mortality rate's still going to fall around 1% when all said being done from the studies. Okay, maybe 1 to 2%, but I believe it's going to be closer to 1. The problem though is if you have all this lower immunity and all these other risk factors, okay, your risks are going to be much higher. Okay, might even be up around 6 to 12%. Okay, so what do we do? What do we learn from this? We need a holistic approach. We need a whole food approach. We need to build our immune system. We need to reverse diabetes, okay? We do that here at Longevity Health Institute. Me and my practitioner has been doing this for years on patients. And we have patients that can tell you this and tell others because that's how we stay busy. They send other patients for us to correct them and get them on the right road. You have to be accepting of functional medicine and a holistic medical approach. Not discounting Western medicine. We use this integratively, but you can let the body heal itself if you give it the tools, just like these supplements, these natural supplements I just covered. So let's accept some of these things. Let's love each other. Let's build an immunity, okay? Let's not stress because it doesn't do anything good to the immune system. Get good sleep, good hydration. You heard me talk about green tea. And incorporate some of these vitamins and natural supplements in your program of your daily health, and I think it'll serve you well in many ways, not just preventing and slowing down COVID-19. If you would like to purchase some of these high medical grade quality supplements, you can go to our supplement shop on our website, longevityhealthinstituteinc.com. On the supplement shop on our website, you can click on that, and the password to order medical grade supplements that I talked about here, particularly on this video, the NAC, the N-acetylcysteine, you can go on there and the password is health. Create an account, put the password in health. It's a fulfillment company we use called Carewell. Excuse me. You can look them up online, Carewell, Karewell. They can be contacted directly by a 1-800 number. And they will ship to you, drop ship to you within 3 to 5 days of the supplements that I mentioned. You can also do a telemedicine visit, whether you're a new patient, an existing patient, or you just have some concerns and questions about immune boosting therapies and antiviral therapies. So visit us on our website, call or email us, and we'll get you scheduled ASAP. With one of my practitioners or myself. So we've been working overtime lately and taking care of all our people and keeping them well, doing telemedicine visits, and we are here for some occasional blood draws and IV therapies for immune boosting, and those are done in a hygienic, individualized, personalized way. So this is Dr. Lewerenz, okay? You can email us any questions. Send me comments and questions on Facebook and on YouTube here, and follow my blog. This is Dr. Lewerenz. Be well, take care of each other, build your immunity, and slow down COVID-19 viral replication with these methods. Take care.